Welcome, everyone, to this Facebook Live. I'm your host. I'm Asia from Magic 102.3 and 92.7. Today, we're going to spend some time talking about how we're taking care of ourselves and, of course, the community, especially when it comes to health. I think this conversation will especially resonate with some entrepreneurs and some small business owners in our community. I'm excited to introduce some of our guests that are joining us this afternoon or this evening. They know a thing or two about balancing health and business with us today. So first, let's welcome Ms. Sherry Curtis from Prince George's County Health Connect. Sherry, thank you so much for joining us tonight.
Hi. Hi, how are you tonight? Thank you for having us.
I'm fine. Thank you so much for joining us again. You know, a little bit about this, how we need to bridge the gap and learn more about take care of ourselves with our health. Sherry's here. She's representing the Maryland Health Connection. She represents the state health marketplace. So Sherry will tell us a little bit about yourself and explain how important knowing more about Health Connection is.
Absolutely. Thank you. And hello, everyone. Good evening and happy holidays for whatever you celebrate. So I am Sherry Curtis. I am pleased to be the manager of Prince George's County Health Connect, which is a program of the Department of Social Services. And we are one of several connector programs across the state. Our goal is to do outreach, education, and enrollment to try to get all eligible residents into health insurance and give them access to improving their health outcomes. And so that's our main goal. That's the driver for this. And right now, the time that we're talking to you is during our open enrollment period, which was November 1st through January 15th. And so we're here to promote the importance of health coverage, why getting health coverage will give you peace of mind, and, let your listeners know that we're available to help people access health coverage and answer questions about their coverage needs.
Absolutely. And I'm sure we have a lot of questions coming your way. Also joining us tonight is Dr. Tam Lucas. Dr. Lucas, tell us just a little bit about yourself.
Well, hello, everyone, and thank you for having me this evening. I'm Dr. Samira Lucas. I am the CEO of the Cube Cowork, which is the largest Black women-owned co-working space in the United States, and we provide babysitting services inside of our co-working space so that parents can focus on building their business and not having to choose between their families and their careers.
Wow. Okay. Thank you so much for joining us tonight, Dr. Lucas. We appreciate you.
Thank you.
And last but not least, we have none other than Sam Smith with us tonight. Sam, tell us a little bit about yourself.
Well, hello, everyone. Thank you so very much for welcoming me here today. I'm Sam Smith. I am a creativepreneur, which manifests outwardly as an accessory designer for my company, New Vintage by Sam. I'm also a style strategist and someone who really takes a holistic approach to the fashion and art space, encouraging people to be more mindful of what we put on our bodies. So this conversation absolutely aligns with my mission, and I'm looking forward to getting into some meat and potatoes here.
All right. Yes. Let's get into the meat and potatoes. That's perfect for the holidays. We've all been eating a lot lately, right? I love how you said that. Let's just start off with a little bit of a kind of like round robin questions. Okay. And just feel free to dive right in when I ask the questions. So how has this last year been for you? I mean, COVID-19. Talk to us about that.
Oh,
Just jump right in.
I will start. It has absolutely been crazy because not only are you trying to care for yourself and your own mental capacity as well as kind of protect your health, you're also worried about protecting others, right? And and their health and the things that are going on and dealing with all of the constraints that COVID-19 has had on us mentally, physically, and emotionally. And then to throw being a business owner and dealing with all of the obstacles that have come our way as business owners while we're dealing with COVID, it brings a lot of stress and unwarranted just health things that will come your way. And so I will say it's been a total roller coaster for me. I've tried to manage it as much and as the best that I can.
Right.
And so, but I'm grateful, I'm thankful, and I'm blessed because I'm still here and I'm able to have this conversation with you. And not many people, there's a lot of people that have lost their lives because of COVID, and also
Absolutely.
just having a lot of health issues because of COVID.
Right. So balancing, like trying to keep your sanity and maintaining a healthy lifestyle throughout the pandemic has been kind of difficult for everybody. I'm going to talk to you, Dr. I'm going to talk to you, Sam. Share with us how difficult this year has been.
So it absolutely was an adjustment period. But all in
Mhm.
all, I am very grateful and appreciative for just the opportunity to just kind of tap into a stillness and really kind of look at the silver linings. There were absolutely some spaces of panic.
Right.
But I was able to just think about, oh, well, this is the reason why I'm a small business owner, because of these types of instances where, things beyond our control happen, but I was still able to find creative ways to still share my story within my business, still keep my customers safe and myself safe. So I would say that I learned so much within this period. It really
Mhm.
kind of helped me to decide, well, are you going to fold or are you going to flourish, and figuring out what that plan of action looked like, and also connecting with other small businesses so we can put our heads together. I think amidst COVID, although, like I said, there were some areas of gray, I
Mhm.
definitely have been able to find more of a community here. Because as much as we were socially distancing, people absolutely yearn to be closer together. So I feel like
Mhm.
we, got a little bit more creative in the ways that we spent time with one another and the ways that we showed up for ourselves and in our families and in our respective, environments. So I appreciate it. It was all a learning experience for me. I don't
Right.
need to be in COVID anymore, though. But I'm absolutely walking away with a lot of golden nuggets here and know that I can absolutely rise above anything.
Absolutely. I love that. I love that. And Sherry, you the same question, please.
Well, yeah, for us, I'll speak in terms of the organization because personally
Okay.
it was highs and lows and sometimes a nightmare and sometimes just an opportunity to be thankful and grateful. Um, but for our staff, we were front facing, we
Right.
saw everybody in
Right.
person and we had to pivot immediately and move to remote. And we were able to do that pretty smoothly, but we spent a lot of time in the beginning, having conversations about self-care because we
Right.
answer the phones of people who are in need of health insurance. And during the special enrollment period during COVID,
Mhm.
people were really challenged. We had an enormous number of people lose their employer coverage
Right.
because they didn't have a job. They
Right.
were smart enough to come to us to try to get, other coverage to make sure they and their families were covered. We had a
Right.
lot of people who didn't ever have health coverage, but sort
Wow.
of got on the train once COVID hit and they thought it was important to be covered. So, we had a lot of messaging around that. But, when you're answering the phone and you're the person who has to listen to those stories, all day on the phone of people who are really struggling
Mm.
with mental health challenges, with loss of coverage, with trying to figure out how to cover their kids and their families. We had to do a lot of self-care talking and chatting to keep ourselves up because once we finished work, we also had to worry about our families and the other aspects. And so it was really incredible. We are
I'm
now back
sure.
at Yeah, we're now back in the office, seeing people face to face, using all the protection that's necessary, of course, to try to be
Right.
safe. But yeah, yeah.
Yeah, I almost wore my
I'm
mask
with
right now. I
Sam.
was like, I had it on. I
I'm
forgot to
okay,
take it
but I'm
off.
I'm ready for it to be over now. We're
Absolutely.
Yeah, we're
Yes.
over it. Yeah.
Sometimes you fall asleep with your mask on. You just don't even know you have it on, right? It's second nature.
Mm-mm.
All right, well, let's talk a little bit about why we are all here today. I mean, currently, of course, there's open enrollment, and there are a lot of people that still need your help, that still have a lot of questions. And so, Sherry, can you tell us why it's so important that we're thinking about health today? I know you mentioned how difficult it was in the midst of the storm through the pandemic, but why is it still just as important today as it was when we were in the midst of all of that?
Well, I mean, you have to get access to health coverage so that you can see the doctor. We
Right.
don't want people using emergency rooms and urgent care as their primary care. We want people to
Right.
identify a medical home. People need to
Right.
find out and understand their baseline and try to reach their maximum level of health. And the way to do that is to have a primary care provider. And so the importance for us, our mantra is get covered, get seen, get healthy. Because,
Right.
first you have to get the coverage, then you got to see a doctor.
Mhm.
So there's a lot of
Mhm.
people walking around, even with coverage, that are not using their coverage. And so it's just really important for people to understand where they are in terms of their health and to learn how to improve that. In our community, particularly communities of color, the health
Mhm.
disparities are just, enormous. And
Right.
with that information, to not have coverage and be able to see a doctor and work towards your maximum level of health is just really critical and important. And if you can get in and get coverage, people are learning that it's not as expensive as they might have thought it was.
Mhm.
Right.
Some people are really getting good discounts based on income and based on family size. And so we just want everybody to check it out, to call the number, to reach out to us, to, do their due diligence, do their homework, see what it means for them, see if what they're paying now can even be less than what they would pay for next year, and
Okay.
just be informed. I think the most important thing is to be informed.
Right.
Just
Right.
to education is key. You don't know what
Right.
you don't know.
Right. And since open enrollment is now in progress, if they sign up now, they'll be covered for next year, right?
Exactly. If everybody signs up by December 31st, particularly those who don't have coverage, their coverage will begin January 1.
Okay. So they'll be all
And
straight for
Medicaid is a year-round program. So some people's income is low enough to qualify for Medicaid, which is year-round. So that's why
Okay.
we want everybody to, to learn what they are eligible for and to make informed decisions.
Okay. We have someone who chimed in, Ernest Lawrence. He says that he's been using the Maryland Health Connection for a while and he's never been disappointed. So thanks so much for joining us, Ernest. We appreciate you. Uh, right now, like I said, we have open enrollment. Is it very difficult or challenging for people to apply?
No,
I'll ask you
no,
that, Sherry.
no. I mean, if they call the number for Prince George's County, if they call 301-927-4500, we have certified navigators answering the phones who will either schedule an appointment or handle them over the phone.
Okay.
And we can do that. So it's not difficult to reach us or to learn where you are
Okay.
in terms of what your financial output will be. Very
Okay.
easy. If they
All
go to
right.
marylandhealthconnection.gov, anybody who has a computer and knows a little bit about using a computer, it is so easy. The application is very easy to follow through with. You just need to make sure that you have your documents with you when you get ready to sign on, like, your income and your social security numbers and, the simple things you would need for the application. And
Mhm.
most people can get through the process in like 30 minutes or less.
Okay. I love that. Thank you so much. Dr. Lucas, talk to us a little bit about some of your biggest challenges being an entrepreneur and starting your own business. How has that affected your health? And just share with us some of your challenges.
So being an entrepreneur, while there are some great things or great reasons to become an entrepreneur, I have to say there are many obstacles that you would face, and that causes a lot of stress
Mm-hmm.
and a lot of anxiety. A lot of people suffer from different types of anxiety and don't realize that they actually do suffer from anxiety, which causes other health issues. And so I know for me, I'm a perfectionist. That's number one, and I'm also serving a very vulnerable population, right? We're mainly focused on mothers, and they tend to be overlooked and
Mm-hmm.
not given opportunities, especially in communities of color. I'm in Baltimore City, and so and
Mm-hmm.
I many of my members and those that come in for different services for their businesses are from Baltimore City. And so that's just the stress, alone of like a burden of me that what I do as a business owner is going to impact the lives of families, and we have to make sure that we are thinking about that. It's not just the entrepreneur that I'm helping generations and hopefully creating generational wealth. And so that has caused, like I said, a lot of stress and a lot of anxiety that has caused me to have health issues that I'm happy that I've been able to overcome. And so one of the things that I would encourage those that are watching, as Sherry said, being informed and making sure that you know what's going on with your body is extremely important. And do not downplay the mental health component.
Right.
I'm grateful to be able to go to therapy every week. And going to
Right.
therapy does not mean that there is absolutely something wrong with you. That means
Right.
that you're releasing the potential of things that could possibly occur with you. And I enjoy it every week.
Right.
But I also get other services that many people don't think about, like acupuncture, which helps a lot with stress. And I go there weekly as well. And so I would just encourage you to really pay attention to your body and utilize the resources that Maryland Health Connection have available in order for you to get covered insurance. Is so important. I know the biggest fear for people to leave their 9 to 5s is, am I going to have health insurance, especially for
Right.
mothers, right? Because it's not
Right.
just about
Right.
you, it's also about your children, right? And so
Right.
I've definitely am one that have utilized Maryland Health Connection, not just for myself, but for my grandmother who's retired, to be able to get affordable health insurance. Because I'm telling you, health, like Sherry said, health disparities in the Black community specifically is major, and we do not pay attention to those things enough. And I was one that was just working, and not paying attention to what my body was telling me. And now, like, I'm on the other side of those things. But please take care of yourself, because this entrepreneurship life, it may look good on social media, but it's not always peaches and cream. I'm telling you that now.
Sam, I see you over there nodding your head. You're like, yes, you agree wholeheartedly, huh?
Absolutely, yes. I wanted to add to the doctor.
Okay.
Absolutely, the space of being an entrepreneur it was a lot of feeling around in the dark, and just really trying to figure out what works for me. Even being amongst other entrepreneurs, their blueprint is not necessarily my own.
Right.
And the cool thing is, when I decided to transition into entrepreneurship, I had transitioned out of a full-time job. I had gotten married, and then
Right.
shortly thereafter we got pregnant. So those are like 3 serious milestones within my life that I did not pace myself for. So of
Right.
course, in trying to grow a business, I was absolutely consumed with trying to figure out all of the things all at once. So I definitely felt my fair share of stress. It's one of the reasons why the language that I use in my business is like really around being intentional about tapping in and tuning into yourself, because that's the only way that we're going to make it. Whether you work a 9 to 5 or an entrepreneur, you really have to be in sync with yourself. And I think a lot of us tend to get just just get on autopilot, to be honest
Right.
with you, until
Right.
our bodies or we break down mentally or whatever the case is. And by that time, it's a little bit too late, or, it just is an ounce of prevention is truly worth a pound of cure. So I have been absolutely tuned into my health and so excited because Maryland Health Connection has absolutely made it super easy for me to find, the proper practitioners for what I need. And just a hub of information and a wealth of information, but you absolutely have to stay informed and stay in tune with your body and just get out ahead of the things before it's too late.
Right. That actually leads me to my next question, Sam. So what concerns did you have about health insurance going into it as an entrepreneur, and then as also a parent and as a wife? Did you have a whole lot of concerns for your family, and would the fact that coverages meet all of your needs from the business aspect as well as from your family perspective? Talk to us a little bit about that.
Absolutely. I was truly fearful because, in a corporate environment, in an actual job, the foundation is set for you. You just go to human resources, you get the things worked out. Whereas as an entrepreneur, you are absolutely just kind of looking to your left and to your right. And to be honest with you, I kind of started my entrepreneurship journey when it was like only a small amount of us, and trying to bounce off ideas from the other. We were all ignorant, clueless, did not have it just not, we're creatives through and through. And, while we can figure some things out, that was absolutely a great space. So for sure, it was cost, trying to figure out what that could look like, coverage, who I could actually go see, who was in my network. So all of those things were, truly something that made me a little bit anxious, like the level and quality of care. Would I be able to continue it, given that I had been a part of, with employers who had pretty good systems as far as their health insurance is concerned. And I did not want, the quality of my health care to fall short. And it did not. It absolutely did not. I'm absolutely in a space of transitioning and trying to understand how I can move better and maneuver through, health insurance for employees when I decide to just kind of onboard them as well. But it's just, it's good to know that this platform exists so that we can ask the questions that we need to ask to get the answers we need.
Okay.
And Maryland
And
Health
that's
Connection
great. So
is really helpful there. I mean, they really are helpful there. They have those resources available. There's a small business hub on the website if you do take on additional employees to help you figure out how to help them. So yeah.
That's great. That's great. So you point your employees into the same direction to Maryland Health. I love that. That's really great. Okay, so let's get into open enrollment right now. So if I were to open enroll, if I were to call and contact, I would be I call the number that you had given us before, right, Sherry? And then I'd be prompted to ask a lot of questions. Is it a long process? Is it something that you do in one night, or is it something that it takes a few days to process? Walk us through what it would be.
I have staff that have enrolled like 20 to 50 people in a day. It's not, it really all depends on how complicated your circumstances are. Okay. But if you go online and set up an account on your own and follow the prompts, most people can get through the entire application on their own. So we encourage people to do that, before they even call. You go to marylandhealthconnection.gov, you put your name, your social security number in, a few, regular basic questions that you would do on any application. And then it begins to ask you other questions to try to help you find the best plan and the best fit for your needs and your budget. And so there are prompted questions that they go through. If somebody gets stuck in the application and doesn't know how to respond or can't move any further along, then we encourage them to call us. We also have a really good relationship with insurance brokers that are certified by the state. And our brokers are just wonderful in terms of helping people with their plan selection. A navigator's typical role is just to provide you access and determine you eligible. But brokers can actually take you to the next level because we have 3 carriers in the state. We have Care First, we have Kaiser Permanente, and we have United Healthcare. And of those 3, there's a variety of value plans. There's a variety of different metal levels, gold, silver, bronze. And that's why we want people to be well informed, because you can make those selections based on your needs and what you have in terms of out-of-pocket, availability for the insurance. People have come in and spent much less than they thought. Like they were paying $400 2 years ago. They came in, their income has changed due to COVID. They're not making the same amount of money anymore. And it got knocked down to like $40. So, there have been some increased savings. There's also a special savings now for 18 to 34-year-olds. And so Maryland is offering another incentive in terms of credits to reduce your premiums because they're trying to encourage more younger people to get enrolled. Because, the young invincibles don't really think that they need that, or they don't want to spend the money because, they need to get their coffee money and their cocktails for the weekend. But what we're learning is that when we engage them and explain to them the importance of that peace of mind and how a broken leg, you can fall off your bike and break your leg if you're not covered, that could set you back for the car you're planning to buy or the house you're planning to buy, because you're looking at $10,000, $15,000 in medical expenses. So when you break it down to young people in, in dollars
Dollars
and
and cents.
cents, it
Mm-hmm.
starts to make more sense to people why it's important to spend that little bit of money every month to have peace of mind and coverage. Um, and we've seen a
Big
lot
time.
of that during COVID, people
Right.
really understanding the importance of having health coverage and getting it. So during this open enrollment period, we're encouraging everybody to come take a look, browse the plans, talk to us, look online, make some decisions about what you can afford and what works best for you and your family, and
Mm-hmm.
and make that informed decision. And we're here to help you finish the process.
I love it. I love it. If you're just tuning in, again, everybody, we are here with the Maryland Health Connection, and so we have some of our favorite Maryland entrepreneurs joining us as well. So it's that time of year when you can actually sign up for a health plan for 2022, and so we want you to drop your questions and comments below. We'll try to get to you as quickly as we can. I know that our audience is very, very happy that we're having this discussion today because there are a lot of people that have questions. Let's see. We have something coming in now. It says, I'm trying to see the question now. I'll get back to it in just a few. But I do have this. You mentioned the types of plans, Sherry, and that is when I saw a lot of actual motion take place because people were that was when it kind of flagged that there are several plans in place. There are three different types you mentioned.
There's three different carriers
Carriers. Okay.
in terms
All
of
right.
providers. So Kaiser Permanente, Care First,
Mm-hmm.
and United Healthcare are the three carriers on the exchange. And each one of the carriers has a variety of options and plans for people to choose from.
Okay, and that's for anybody in the state of Maryland. They can actually choose from the different carriers and providers that are there. Okay.
Right.
And from there, they would actually pick out their plans. Is that how it would work?
Once
Or,
you complete the application and their eligibility is determined, which would let
mm-hmm,
if you're eligible for health insurance,
mm-hmm.
then you move into the next part of the application, which be to identify your plan and plan selection. And so a broker can give you guidance, but a lot of it is really very simple once you get on the site. We
Okay.
don't have
So
time. We
someone
don't
will,
have time to do a demo, but yeah,
right.
yeah.
But
Once
someone
you,
would be
once you,
there to walk them through the process. And there's a lot of help
absolutely.
available
And
online.
that's
Again,
why
we
I
want,
said
say again, I'm sorry.
if you go online and you get to the point where you're a little confused or you don't know what to select at that very moment, as long as you do it before December 31st, you can still get January coverage um, by reaching out to us, and we can walk you through the rest of the application.
All right, we have a really good question that just popped up. It says, question, if you live in DC, but your business is in Maryland, would Health Connection be able to work out a plan?
I don't have the exact answer for that.
Okay.
If you're doing it as an individual,
Okay.
then you would do it in the place where you live.
Okay. Okay.
If you're registering as a business, then you would go to marylandhealthconnection.gov/shop or small business. And that way you could get the information that you need to register as a small business. So it really depends on how you want to come in. If it's just for you by yourself, then you may want to do it in the place where you live.
Okay. Thank
If
you
you
for
are
that.
trying to enroll yourself and other staff members
Mm-hmm.
as an organization, then you'd want to go to the small business link for Maryland Health Connection and do it through the small business program.
Okay. Great. That's perfect. Dr. Lucas, what advice would you have for other entrepreneurs? Like what programs did you pick for you yourself? And did you pick any other services for your employees? And if so, again, which direction would you point to other small businesses much like yours?
So I would definitely say to just go on and shop around,
Okay.
and to make sure that you choose what's best for you. For me, it was really important for me not to have to change any of my healthcare providers.
Okay.
Um, like that was just a non-negotiable for me. And so I had to choose the plan that, you know, made sure that I didn't have to make those changes, and not just healthcare providers for myself, but for my daughter as well. I'm very
Right.
particular about those type of things, and so it was very important for me to be able to get coverage that everyone that I was previously seeing um, would still be in my network, and I would still be able to utilize their services. For small business owners, like we currently, as of right now, we don't currently offer any, health benefits, but we do utilize the fact that Maryland Health Connection is available
Right.
for our employees, to let them know that they do have these resources. We actually just had someone come in from Maryland. I just thought about it. Give a workshop to some of the business owners around near in the same community as my co-working space, and so they were able to also learn about what's available to them. Because I think, and Sam talked about this, the biggest fear for me was, as an entrepreneur, was, am I going to be able to have health insurance? Like I don't
Right.
think I really cared about anything else too much besides the fact that I need to make sure that I have health insurance for myself, my daughter, and my husband. And so that
Right.
was extremely important. But I will say it was also helpful with my grandmother, and with her being on a very limited income, and making sure that she's able to get affordable health care as well. And I really begin the navigating the system because of her, and helping her to kind of maneuver around and get the insurance that she needed without changing her providers as well.
Okay. That's awesome. Sam, same question. We want to ask you a little bit about what some of your options were available. What the options that you had available were. Was it easy for you to pick out, the perfect plan for you yourself? And I know you mentioned earlier that you have some employees as well. What advice would you give to an upcoming entrepreneur, and what direction would you point them in?
Honestly, I kind of shuffled the deck with my providers.
Okay.
So I transitioned to a different network. So of course that allowed some of the other parties, or physicians and such that I was working with, I couldn't work with them anymore. But it allowed me to usher in a new group of providers and physicians who could serve me in a way. And also because a lot of the providers that I had previously were people that I had grown up with, but still did not feel connected to.
Right.
Now I had the opportunity to shop around for more folks that look like me.
Mm-hmm.
And also, you know what I mean, showed up in the ways in health that I required. So my advice, like Dr. Tamira said, is to absolutely shop around. My carrier is United Healthcare. So with them, I was able to reach out directly and really find some options for me to go see, whether it be for mental health or
Mm-hmm.
something a little bit more specific. The information was there. It was literally about me just being prepared. And it absolutely helps to have all of your things prepared prior to. Just having perhaps maybe even like a little notepad. I always have a notepad with just like general information for specific topics. And Maryland
Mm-hmm.
Health Connection has its own notepad with my numbers and information and contact numbers, so that it's easy to reference. Because sometimes
Mm-hmm.
that's a headache too, when you really just want to get the answer to your questions and you're like, oh my goodness, what's the toll-free number? What's this? What's that? So
Right.
I took some time to really set myself up. Once I was able to shop around and find some new folks, I made sure that I also created a notepad or a space to kind of house that information, so it'll be ready at a quick glance if I need to.
Okay. I love that. And Sherry, once again, can you share with everybody, remind us how we can enroll and the time periods? Right now, open enrollment is now in progress, and it's going on. It started November 1st and it's going on through January
January
15th.
15th.
Okay. Just remind us again how we could do just that, how we can enroll, and how easy it is.
Yeah, everybody just, if you are not insured at all, we encourage you to find out what you're eligible for, because you may be able to have very low cost or no cost coverage. If you are insured and you just want to find out whether or not you're in the right situation, or if you can achieve some savings, you can go to
Mm-hmm.
marylandhealthconnection.gov and do it right straight. We have a mobile app. You can do it even on your phone. It's in Google Play and in the Apple. You can get Maryland Health Connection that way.
Mm-hmm.
You can call the toll-free number. If you're in Prince George's County, you can call 301-927-4500. And I have to tell you, statewide, the people that provide these navigation services, particularly in the local, offices, are just amazing.
Okay.
Most of them have been with the program for 5+ years. They're very skilled, they're very astute, and these ladies can probably tell you the experience, and just like the person who, you know, the experience has really been great for people.
Mm-hmm.
I'm not going to try to sugarcoat it though, because there are people that have high incomes with, larger families who get hit with some sticker shock, you
Right.
know, um, and that's when it's good to talk to a broker, because
Okay.
you may be able to leverage maybe your deductible a little higher, so your premium could be a little lower. You may look at whether or not this particular plan covers your prescriptions that you need while other plans don't. So
Right.
there is a variety to choose from. And I
Right.
think the bottom line, and everybody would agree, that education is key. And the only way you're going to find out is if you call us and check us out. You know,
I
if
love
you
it.
go online and just figure it out. We want everybody to be covered. Everybody who is eligible, we need to be covered. We know in Prince George's County, there's at least 50,000 or so eligible people
Wow.
that still need health insurance. And most of
Okay.
them are in communities of color and between the ages of 18 and 35 or 40. So, we really want people to learn. There's people out there that are artists, that are musicians, who just don't
Mhm.
even think that they can get health insurance. There's entrepreneurs, sole proprietors that work on their own. They have their own small business and don't even realize that they're eligible to get health coverage. And we just want everybody to reach their maximum level of health. That's what this is really all about. Getting
Right.
coverage is critical, but it's not just to have a card in your pocket. We want people to be healthier.
Right.
Mental health is an essential benefit. If you register on the exchange, mental health coverage is available through all of the carriers. And
Right.
so, you don't have to stay stressed out like Dr. Tamara said. You don't have to. You can get resources that can help you navigate this world,
Right.
and what we're doing now and what you're going to do in the future.
Right.
Yeah.
Because everyone deserves peace of mind, right?
Absolutely. I mean,
Yes.
that you check that off the list. We all have so many other challenges in our life.
Right.
So, having this is one comfort that we can deal with, so that we can move on with all the other things that are coming at us every day.
Absolutely. Absolutely. So thank you all so much for joining us today. Again, we were joined by Sherry Curtis, Dr. Tam Lucas, and the lovely Miss Sam Smith. We're here today just to remind everybody that open enrollment is now in progress. We want everybody to please, if you are receiving or a Medicaid recipient, you can actually apply anytime, but open enrollment is now in progress through, again, January 15th of 2022. Just to give you a quick recap, you can get most of your questions answered just by visiting marylandhealthconnection.gov to learn more. You can get an estimate of your health insurance costs. You can compare your options, your plan options, and so much more. And just find out, again, what program works best for you. So we thank you so much for joining us today. Sherry, it was a pleasure. Dr. Lucas, it was a pleasure. Sam, such a pleasure. Let everybody know really quickly before we get off the line, how can they reach you or how can they follow you on social media? I'll start with you first, Sam.
You can follow me at New Vintage by Sam. It's right here. It's right here. On Instagram. Sam Was Here on Facebook, and samwashere.org for all of the things Sam related.
I love that. Dr. Lucas, same question.
Yep, you can follow me right there at the Business Doctor, and you can follow the Cube at the Cube Cowork. So it's the Cube Cowork on all social media, and you can go to our website, thecubecowork.com.
I love that. I love that. And Sherry, everybody's going to call you asking a bunch of questions. So let everybody know how they could get in touch with you on social media.
And that's why we're here. It's 301-927-4500 or marylandhealthconnection.gov. We also have our own website, pgchealthconnect.org, which is the local one that has information about all of our locations, where you can get help, some videos and other kinds of resources. And, we just want to thank you for the opportunity, because we know you have a large listening audience, and we just hope and pray that several people that were listening today are ready to call us and get busy with peace of mind.
I love that. I love it. We had a lot of people chime in just today. So you'll see the numbers going up, I promise. Again, I've been your host. It's been a pleasure and an honor to be your host. I'm Asia, your radio love from Magic 102.3 and 92.7, the real sound of the DMV. You can follow me at Always Ask Asia on Facebook, Instagram, Twitter, and Clubhouse. Again, that's Always Ask Asia. And again, we thank you so much for joining us here with the Maryland Health Connection, because we all deserve a peace of mind.
And that